Good afternoon, everyone. Thank you for joining us today to discuss sexually transmitted infections, or STIs. My name is Karen Curtis. I am a provider outreach and education specialist here at WPS. Tom Ryan is joining me today as my co-host. He's going to help me out by monitoring the chat for questions that you may have, and he's also going to provide some additional information and just help out during the webinar. I have just a couple of things to cover before we get started. The Training Center webpage is where you can find information related to the Provider Outreach and Education team. A copy of today's slide presentation is available for download on the live events page. There you will find upcoming education, links to register for those webinars, and then in the column that's titled Materials, you're going to find a link to the PowerPoint slides that we show during our events. The Training Center is also home to our Encore Presentations webpage. All of our webinars are recorded, and if there are no technical difficulties, the videos will be posted to our Encore Presentation webpage along with our YouTube channel. Videos are available for up to 90 days, and they can be watched on our webpage without you having to go to YouTube. We know that some of you may not be able to access YouTube with your company computer, and we want you to be able to get to receive the education that interests you. After 90 days, the videos will be removed, but they will remain on our YouTube channel until information changes. Later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. I did receive some pre-submitted questions, which I will answer at that time. If there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in the presentation, you will be given an opportunity to provide feedback on today's event. This is your chance to let us know what you feel we're doing right. Let us know if you think there's areas where we can improve. It also allows you to give us input on what types of education you'd like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you asked for. Now, here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations take priority over anything presented today. I also need to let you know that CMS does prohibit the recording of this webinar. We're recording this event so it can be posted as an encore presentation. The recording will be available next week if you would like to review or share any of the material being presented today. I hope by the end of today's webinar, you'll have a better understanding of what Medicare covers when it comes to sexually transmitted infections. I'm going to start out with a little general information. I'll discuss coverage criteria, how to submit claims to Medicare, checking eligibility, and we'll finish up with a few resources that are available. This is the American Medical Association copyright notice for CPT codes. During this presentation, I will provide billing information which contains CPT codes. This notice just lets you know that Medicare does not own CPT codes or their descriptions. We have one more copyright notice. This one is from the American Hospital Association National Uniform Billing Committee. This is required because I discuss coding that would be included on a UBO 4 or 837I. So I have to let you know that the American Hospital Association is not responsible for, nor were they involved in the preparation of this material or the information being provided today. Now, for those of you who don't know, each month I hold a webinar on different preventive services that are covered by Medicare. I honestly did not think that STIs was an issue for Medicare in the Medicare community, and I ended up being really surprised in what I found. Now, rates of STIs among adults 65 and older have more than doubled in the past 10 years. To break that down further, cases of syphilis have increased sevenfold, gonorrhea fivefold, and chlamydia has more than tripled. There's such a need for screening and education. As you can see, 40% of adults aged 64 to 80 are sexually active. Now, the downside to this is that only 3% are using condoms. Now, there are both medical advancements and social changes that have contributed to the rates of the increased sexual activity. Medical advancements have extended people's sex lives. For women, hormone replacement therapy can improve menopause symptoms that may have affected sex drive or made intercourse uncomfortable in the past. For men, drugs such as Viagra have allowed them to remain sexually active later in life. Society has changed a lot in the lifespan of many Medicare patients. When I was in junior high, we had sex education classes, but I'm sure my dad didn't have them at his school in Stickney, South Dakota. This lack of knowledge can contribute to unsafe practices. Seniors now have an option of living in 55 plus communities. Individuals who no longer want the responsibility that comes with owning a home, but maybe they're not in need of assisted living. Now they've created these apartment complexes that are just for 55 plus. So when they move in, they're surrounded by others their own age. Many of these communities have social activities, so there's an opportunity to meet others and form relationships. In general, life expectancy increases over time. Medical advancements in medicine, technology, and treatment have helped. Public health improvements, socioeconomic factors such as improved sanitation, public health campaigns that are focusing on disease prevention, and increased living standards. Lifestyle changes is something that I've really noticed, especially the decrease in the amount of people who smoke. When I was younger, it seemed as if everyone smoked. I mean, there were ashtrays on airplanes. But now you just don't see people smoking in public. So a lot of these changes have extended people's life expectancy. Finally is divorce rates. More people get divorced now than they did 40 years ago. Instead of having a once in a lifetime partner, people may get married a second or third time. Some may never marry again and just date. Although I don't have this on the slide, you also have to take into account those who have become widows or widowers. With more opportunities to connect with others in the same circumstance, the possibility for creating a new relationship is possible. Now let's talk about coverage. You're going to see that CMS has different coverage requirements listed for different tests. Now, all of these can be found in the LCD linked on the resource slide, but we're going to go through each one of them. Well, in general, these services are covered under Medicare Part B for sexually active adolescents and adults at increased risk of contracting STIs. Services should be referred by a primary care physician or practitioner and provided by a Medicare eligible primary care provider in a primary care setting. The NCD does define many of these terms, so if there's anything that you're questioning what CMS means by this, those definitions can be found there. Covered tests are going to include chlamydia, gonorrhea, syphilis, and hepatitis B. Screenings should be performed with the FDA-approved lab test and used consistently with FDA-approved labeling. It also needs to be in compliance with the Clinical Laboratory Improvement Act regulations. That's also known as CLIA. Now, for chlamydia and gonorrhea, patients must be pregnant women 24 years or younger, pregnant women at increased risk for sexually transmitted infection, and non-pregnant women at increased risk for STIs. Screening for syphilis is for pregnant women or men and women who are at increased risk for STIs. Screening for hepatitis B is included, but it is only for pregnant women. Now, along with lab tests, Medicare does offer high-intensity behavioral counseling, or HBIC. The program is intended to promote sexual risk reduction or risk avoidance. Sexual risk reduction refers to strategies and action that can be taken to minimize the potential negative consequences of sexual activity. The primary focus is on preventing unwanted pregnancies and the spread of sexually transmitted infections. The counseling includes broad topics such as education, skills training, and guidance on how to change sexual behavior. This allows the provider to customize the counseling to meet the patient's individual needs. Now, HIBC should be referred for sexual active adolescents and adults that are at increased risk for STIs. Now, a common denominator in most of the coverage criteria is the term increased risk for STIs. But what does that really mean? When it comes to preventive services, CMS takes a lot of recommendations from the United States Preventive Services Task Force, or USPSTF. They're also referred to as the task force. Here I have listed what CMS considers as high or increased risk of sexual behaviors based on the USPSTF guidelines. Multiple sexual partners. Having multiple partners exposes individuals to a wider range of potential infections. It also increases the likelihood of transmission. This can also lead to a situation where conversations about STI status maybe aren't being discussed. Using barrier protection inconsistently can also cause increased exposure and risk of STI transmission, as well as pregnancy. Alcohol and drugs can impair judgment. It can reduce inhibitions and alter perceptions of risk. When an individual's judgment is impaired, they may not make good decisions in regards to safe sex practices. Reduced inhibitions may cause someone to engage in behaviors that they would normally avoid. If a person is having sex in exchange for money or drugs, they're most likely going to have multiple partners. This is going to increase their risk of exposure and transmission. Maybe clients demand that the sex be unprotected. If sex is going to be used in exchange for drugs, then again, you run into impaired judgment and possible needle sharing. Age can be a factor. Younger individuals are more likely to engage in risky behavior compared to older adults. Of course, there are some older adults that figure, hey, I've lived a long life. I might as well do what I want to do. So that can happen also. Studies done by the task force did find that age to be particularly relevant in cases of chlamydia and gonorrhea, but I'm sure it could probably just be a factor in general. Anyone who has had an STI within the past year is considered to be at high risk. IV drug use. Now, the task force mentions this for hepatitis B, but I would think that this could apply to multiple infections. Men having sex with other men and engaging in high-risk behavior. Lastly, when there is a high prevalence of STIs in the community populations, many factors can come into play, including age or lack of access to health care. So now that we've talked about coverage, let's discuss how to submit those claims to Medicare. When billing for chlamydia tests, there are a wide range of codes that are available depending on the type of test that is performed. I do want to talk for a moment about code 87800. We are going to take a look at the Medicare Preventive Services tool, and there are a few codes that can be used when you are performing a combined chlamydia and gonorrhea test. 87800 is one of those codes. In a moment, you'll see there are a couple other codes to be used, but it all just depends on the type of test that's being run. We will take a closer look at those. Now here we have the applicable codes for gonorrhea testing. Again, you see the 87800 is listed for those combined tests. Here are the other codes that can be used for combined testing. I do want to mention, I am not sure if any of you are the type that use the internet-only manuals to help with billing information, but if you do, the sections on STIs still list using code 0353U. That code was deleted June 30th of last year, and it was replaced with code 0455U. So I just want to make you aware of that in case you are somebody that uses those internet-only manuals. Here we have the codes that would apply to syphilis testing. Hepatitis B testing, again, this is only going to apply to pregnant women. Now here's a list of the appropriate diagnosis codes that should be included on your claim. This was taken from the Medicare Preventive Services tool because it contained all of the information in one place. Now, the first column lists the condition and the test being performed. Notice that all of these require a minimum of 2 diagnosis codes. So the easiest way, you kind of have non-pregnant and high-risk women. It talks about the chlamydia, gonorrhea, or syphilis, but you can see it has the first code listed. This says any of these. This one says and one of these. But if we look down at the hepatitis B screening, you have to have this and one of these if they are a high-risk pregnant woman. So I just wanted to make sure to point that out. And there are going to be system edits that are going to check for all that. Now, if you use FIS and you submit claims on a UB04 or an 837I, the types of bills that should be used are going to include a 13X for outpatient hospital services, a 14X for non-patient laboratory services, and an 85X if you're a critical access hospital. I've also provided a list of specialty codes. These would be used to bill MCS on a CMS 1500 or an 837P. Now, high-intensity behavior counseling is going to be billed using code G0445 along with the diagnosis code Z7289. I've listed the type of bills that should be used if billing FIS. Rural health clinics and federally qualified health centers should use the revenue code in the 52X range. And the reason for this is to ensure that the deductible and coinsurance are not applied. If you are a Method 2 critical access hospital, you're going to want to use revenue codes in the 96X, 97X, or 98X range. For MCS, Medicare provides coverage for HIBC only when provided by a primary care practitioner at a specialty that was listed on slide 28 and a place of service that is shown here. I do want to make sure to cover frequency so that we can try to avoid claim rejections. Chlamydia and gonorrhea tests can be billed once in a 12-month period for women who are at increased risk. The best way to avoid frequency edits is to make sure that 11 full months have passed since the last test was performed. For example, if a patient was tested in January of 2025, you're going to start counting those 11 full months in February. So that's going to make them eligible to be tested again in January of 2026 if they are still considered at an increased risk. Pregnant women are eligible for 2 screenings per pregnancy, 1 test at the time the patient is diagnosed as pregnant, and the 2nd test during the 3rd trimester if high-risk sexual behavior has occurred since the initial testing. Syphilis is covered once in a 12-month period for men and women at increased risk. For pregnant women, testing is covered at the time the patient is diagnosed as pregnant, and a 2nd test during the 3rd trimester, and at delivery if high-risk sexual behavior has occurred since the initial testing. Hepatitis B testing is billable at the first prenatal visit. Rescreening can be performed at the time of delivery if the patient has new or continuing risk behaviors. For the high-intensity behavioral counseling, Medicare will cover up to 2 sessions a year. Counseling should last 20 to 30 minutes and it should be provided face-to-face. So how are you going to know if the patient has been tested and when? There are a few options when it comes to checking patient eligibility. We have the WPS SecureNet Access Portal, which is also often referred to as the portal. Users must be registered with WPS to view a beneficiary's eligibility information. When you visit the WPS website, there's a box that takes up the majority of the screen, and this is where you can register or you can log in if you already have an account. Information regarding STI services can be found on the Preventive Services tab within the eligibility check. Direct data entry, or DDE, is an option for providers who bill using the Fiscal Intermediary Standard System, or FIS. I know that common working file eligibility is something that is going away for DDE, so there may only be a few of you that have the possibility to access that information. The HIPAA Eligibility Transaction System, or HETS, is available for both Part A and Part B providers. And it provides it provides access to eligibility data in a real-time environment. This option involves submitting files via electronic data interchange, so a trading partner agreement is required. Providers, clearinghouses, and third-party vendors can transmit a 270 request, which will be processed, and a 271 response will be received. Response files are accurate at the time of transaction and should not be interpreted as a guarantee of payment. Now, I have provided a couple resources that I think can help with coverage and billing services, so I do want to take a look at those. Let's start with the Medicare Preventive Services tool. This is a tool that I find helpful regardless of what preventive service you're looking for. Um, you can see that it has all of them listed out here. These that have a T with a circle in it, that means that it is eligible for telehealth services. So if we go down here, this lets you know that there are services for STIs which are telehealth eligible. There is a link here to the NCD. I also like using this particular tool because they review it quarterly. So kind of like I mentioned that the internet only manual still has a deleted code. This is updated quarterly, so there may be some more up-to-date information that you'd find here that you wouldn't find there. Now here they do list all the tests in one place. Here's where I was talking about if this is the type of test that you are performing. If you want to do it for both the chlamydia and gonorrhea, you would use the 87800. But then it does have these other tests that can be run for the combined. So I just wanted to make you aware of that. It does have a link here that takes you to the hepatitis B screening information for pregnant women. And here's where we had all of the diagnosis codes that should be used. It also gives Medicare coverage information and frequency. It gives you what the patient would owe. And a lot of times in these other notes, it gives additional information, like here's a link to the NCD manual. I'm going to go back up here. If we click on the NCD, it does go through each of the coverage information, who's covered for what services. I had talked about the definition, so I do want to show you that. It has here, for purposes of this NCD, this is what primary care setting means. This is what primary care physician means. So it kind of defines that in case you just want a little bit more information on what the regulations mean. Now I will take you out and show you. For the internet-only manuals, publication 100-4, which is the claims processing, chapter 18, is the section for all preventive services. And I do find the internet-only manuals helpful when it comes to type of bills that should be used or revenue codes. Like as you see down here, it gives information about specialty and place of service. So I do think that the internet-only manuals do provide details on that information that you can't always find somewhere else. I'm sorry if the scrolling bothers you. Please just look away for a moment. Here's where it still has the outdated code. So this is one spot where you would probably want to use like the Medicare Preventive Services tool, just because it's going to be more up to date. Now, before I ask Tom if any questions have come through in the chat, I do want to address some of the pre-submitted questions that I did receive during registration. First, does billing as a screening versus with a diagnostic code at the time of a screening reimburse the same? Now, the allowed amount for the code would be the same, but the patient liability could be different. So that would be one reason why, if it is a screening service, you would want to make sure to use that screening code. Next question is how to get STIs testing paid on Medicare Advantage patients. Medicare Advantage plans are supposed to follow the same guidelines as regular Medicare, but since WPS does not process Medicare Advantage claims, you would need to contact the company that the plan is through in order to discuss whatever specific issues you're having. Unfortunately, that's not something that we can research or anything like that. How laboratories can educate providers on diagnosing versus screening. I have to say, I am very surprised that I could not find any CMS resources that just flat out define diagnostic versus screening. I even looked in the Medicare and You handbook, which is given to beneficiaries. I thought maybe there might be something there. The only suggestion I have is to Google Medicare's definition of diagnostic versus screening. Now, while the resources provided are not from CMS, they still may be something that you could find helpful. I found the information in there helpful, but again, it's not a CMS.gov resource. Well, that is all I had for pre-submitted questions, so I am going to ask Tom if anything has come through in the chat.
Hey, Karen, we don't have anything in the chat.
Okay, thank you so much. Now, after the close of today's webinar, you will receive a thank you for attending email. There are two sections I'd like to call your attention to. The first section is titled Your Opinion Matters, and it will give you an opportunity to provide feedback if you have not already done so. The second section is titled Certificate of Achievement. This gives you proof of attendance and contact hours that can be submitted to your crediting organization for continued education units. If you don't get this email, please check your junk or spam folder. You will also need to add messenger@webex.com to your safe sender list. That way you can avoid issues in the future. I do need to let you know that if you only joined by phone, you will not receive this email. Just WebEx has no way of tracking it, so they don't have an email address to send it to. If you did do that, please send an email to the education mailbox, put your name and the phone number that you used to join, and that way a certificate can be emailed to you. Now, if you do think of any questions after the webinar, you do have 7 days to send those in. And you can send an email to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that the staff knows that your question is related to this webinar, and they will send it directly to me. Remember, if your question is claim specific, those should go to customer service. We don't have access to the system, so we can't look up your specific claim. Now, when you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Tom add a link into the chat. Your feedback really does mean a lot to us. We review what you have to say, and we really do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you'd like to see us provide education on in the future, so please be specific. Recently, last month, we did hold a Medicare Education Expo. The topic of that day was LCDs and NCDs, and that was based on feedback that we got from our serve days. A lot of people wanted education on that. So we did have a whole day where we held 5 different webinars just on those topics. Those are available on our YouTube channel and our Encore presentation webpage if that's something that you want to look at. We also did recently add training indicators to our events so that you can get some information as to whether it's going to pertain to you. It might tell you if it's clinical, billing, technical, something like that. We also added chapters to our Encore presentations so that you can kind of see what topics are going to be covered. If there's something specific you want to jump to, you can just click on that chapter and it will take you there. The redirect is going to look like what you see here at the bottom of the screen. We don't have control over how this appears, so we just want to let you know it's not spam, it's nothing malicious. It is a CMS survey. That brings us to the end of today's presentation. On behalf of myself, Tom, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.